How much alcohol can I drink safely? Alcohol, or more specifically ethanol, is the most common toxin and carcinogen that humans drink voluntarily. We previously believed that there were safe drinking standards. For example, that a woman should drink no more than one standard drink a day. However, more recent evidence shows that there really is no safe level of alcohol consumption, particularly if you're looking at your risk for developing cancer. Rather, alcohol intake should really be seen as more of a calculated risk. You want to balance the potential benefit of short-term alcohol-induced changes in your brain chemistry with the potential long-term risks of alcohol-related disease. Hi, I'm Dr. Maria Conley. Today, we're going to talk about how to make the most educated decision regarding how much alcohol or ethanol to drink. It really is an individual choice based on your own values and priorities. Ethanol is the type of alcohol found in beer, wine, and liquor. There's no safe level of ethanol intake if you're concerned about your risk of developing cancer. Drinking any alcohol at all significantly increases your risk of mouth, pharynx, larynx cancers, esophageal cancer, this would be squamous cell carcinoma, and breast cancer in females. This is why drinking standards should really be considered low risk standards rather than safe thresholds of alcohol intake. If you have 2 or more alcoholic drinks a day, you increase your risk of colorectal cancer. If you increase that to 3 or more drinks a day, you increase your risk of stomach cancer and liver cancer. Ethanol and its primary breakdown product, acetaldehyde, are both classified as class 1 carcinogens or cancer-causing substances by the International Agency on the Research of Cancer. Other carcinogens in this class include tobacco smoke, ionizing radiation, and arsenic. Ethanol is directly toxic to body surfaces that it contacts during the process of digestion. As it is broken down by your liver, ethanol also creates toxic and carcinogenic compounds, including unstable reactive oxygen species. Acetaldehyde also wreaks havoc on your body. It attaches to proteins and DNA in your body, forming adducts. These modified proteins or adducts in DNA no longer work properly. Acetaldehyde increases oxidative injury by depleting your stores of glutathione, which is really a very important antioxidant. It is directly toxic to organs such as the liver, much like the very similar compound formaldehyde, which is used for preserving bodies. Ethanol is a small molecule that dissolves both in water and in fat tissue. This allows it to permeate all over your body. This means that it has toxic effects on almost any organ you can think of. Most commonly, alcohol damages your cardiovascular system by increasing your blood pressure and impairing the ability of your heart muscle to effectively pump blood. This is known as alcoholic cardiomyopathy. Most of its toxic effects start at levels above U.S. drinking standards, which would be 1 standard drink a day for women and 2 standard drinks a day for men. For men and women over age 65, the limit is not more than 1 standard drink a day. As a poison, ethanol is broken down by your liver into acetaldehyde and finally into the non-toxic substance acetate, which can then be used by your body to make fat or to create energy. Since your liver is responsible for breaking down most of the alcohol that you drink, it can fail when you drink too much. End-stage liver disease is called cirrhosis. At this point, your liver is barely functional and it's replaced primarily by scar tissue. Most of the data looking at the quantity of alcohol and your lifetime risk for developing cirrhosis involve alcohol drinkers from at least 20 years ago. One of the most well-known studies was Lelbach's study in 1975. He looked at male alcohol drinkers with an average weight of 154 pounds, which is much lower than the average weight of anybody today. He found that a lifetime consumption of 12 grams of ethanol per kilogram body weight was associated with a 12% risk of developing cirrhosis. Those who drank more than 40 kilograms alcohol per kilogram body weight had a 90% lifetime risk of developing cirrhosis. It's likely that the risk thresholds are even lower today because people could start out with non-alcoholic fatty liver disease, which is much more common today. Complications such as cirrhosis and heart failure typically develop after 10 to 20 years of heavy alcohol intake. As a rough estimate, if you drink a fifth of hard liquor daily for 10 years, you would have greater than 50% chance of developing cirrhosis. A fifth of hard liquor is equal to 25 fluid ounces, 750 milliliters, or 17 shots of alcohol. Since ethanol permeates so well throughout your body, it's associated with risks of many different diseases, and each of these diseases has a different dose-response relationship with alcohol. Taking a calculated risk involves balancing the above harms with the possible benefits. The benefits of ethanol intake may include a short-term alteration in your brain chemistry caused by increased levels of neurotransmitters in your brain, such as GABA, serotonin, and dopamine. This can cause feelings of relaxation, happiness, and sociability. In summary, if you want to enjoy alcohol, it's best to drink under the U.S. low-risk drinking standards to avoid developing toxic effects in organs such as the liver, heart, brain, pancreas, and vascular system. However, to lower your risk of developing cancer, it's best to not drink any alcohol at all. Thank you for listening. I hope this is helpful for you.